Well, let's take a look at news just in South Africa today. The number of COVID-19 cases reported, 2,465 new cases, with a further 114 COVID-19 related deaths. For more on this new variant that has been spoken about and detected in South Africa, Botswana and Hong Kong, we're joined by the COVID-19 Ministerial Advisory Committee co-chair, Professor Koleka Mlisana. Professor Mlisana, good evening to you. Thank you for your time tonight. As always, the discovery of a new variant creates a lot of concern, sometimes maybe even panic among South Africans. What do we know about this variant right now, and how should people be responding? What is the responsible response to this news?
Good evening, Kathy, and good evening to all the viewers, and thank you for having me once more. Yes, actually, we always dread such findings, and as you correctly say, I think everybody is, to be honest, we are all in a panic mode, especially because this is very new. I mean, we're talking about what has just been described in the last few days, literally. And so to just try and get a better understanding and clearer, but at the same time, be able to give direction, it just means we are all now on our toes and trying to work as hard as we possibly can. So what we know, as already been described, is that this is a variant that, because of the processes and systems that we have put in place in the country, one of those being the genomic surveillance, we have been monitoring, isolates of the SARS-CoV-2 very, consistently, and because we wanted to ensure that we know what virus is circulating at any point in time. And so what we then saw, which we had not seen before, was that in the maybe since the beginning of November, mid-November, in the diagnostic labs, when we're doing the PCR to make a diagnosis for COVID-19, the lab teams, they realized that there was something strange in the positive samples, in that one of the genes that are used to actually detect and pick up that somebody has got COVID-19, one of the genes was dropping out, and this is an S gene. And as these S gene dropouts were accumulating, then we took those isolates, submitted them for gene sequencing. And these now, what was actually announced by Professor Tulio de Oliveira, are some of those isolates. And when we realized this S gene dropouts, then a lot more isolates have been submitted for analysis. And when then they did the sequencing, they then came, they discovered that there was this variant which actually has got these multiple, mutations, more than 30 mutations, and about 10 or so that are in the S, in the spike protein. And what is now of concern is that actually all those isolates that had the S gene, a target failure, they actually have proven to be, this variant. And, somebody mentioned already that is a B1.1529. Now, what we don't know, but just looking at the mutations, they are in the regions where other variants of concern had mutations and ended up having high transmissibility. So as we speak now, everything really is still in the air, but it is pointing towards that this variant is likely to be highly transmissible. What also we're noticing is that if you remember and you will recall that, when we look at transmission, we usually look at the reproductive number. As of today, specifically in Gauteng, this has jumped to be above 2. Just the other day, we were concerned when we saw that it was at 1.5. So this means, it actually confirms that we're likely dealing with a highly transmissible variant. Now, we saw this spike of cases around, in the Gauteng province, and specifically starting in Tshwane, but we really believe that now anything that happens, in Gauteng quickly disseminate throughout the country because, this is the hub of the country. And so really, there's no reason for us to believe it will be confined just in the Gauteng province, but that's where the increased numbers are. Now, that's number one, transmissibility. Now, what about, a vaccine efficacy? So far, if we look at all the vaccines that actually, specifically the two that we have in the country and other vaccines in other countries, they really have maintained efficacy, especially for severe disease and deaths and hospital admissions. We really have got, so far, we are optimistic that we will see the same, in that even though it may be highly transmissible, we are really trusting that, the efficacy to the vaccines that are available will still be good. But like I say, we need to do further studies. So our scientists are busy trying to see that and testing this variant against the sera of vaccinated individuals. So that is where we are. The other thing, Keith, that we're still not sure of is who is really getting infected, in that, are these vaccinated individuals or non-vaccinated individuals? And we need to actually make that, get that data very quickly. And also what's going to be important is going to be, what about the clinical picture? Is this going to cause severe disease or not? We don't have those answers, but at least we do have systems that are in place in the country for us to be able to pick that up very soon. Because if then we see that there's an impact on the clinical presentation in that, then, and the question that always comes up, how does that impact on healthcare systems? Is it going to overburden, the hospitals? And that's what we really need to be concerned about, and we're looking at that very closely.
Professor Mlisana, again, many people would automatically be going to what this discovery then is likely to trigger in terms of government's response to the news. And we're also in a situation where, by and large, we've come out of an election season where we saw just absolutely no regard for the fact that we still have COVID-19 protocols in place. And part of why that's important is that it comes down to the kind of credibility that government's messaging can enjoy among the population of the country. So let's talk about what some of the scenarios currently that you're looking at in the midst of then this discovery.
Yes, thank you for that, Kathy. Yes, I mean, these are all the issues that we need to consider. Now, firstly, I think what is really going to be, what's important, and that's the message we want to continue to send forth, is insofar as vaccination is concerned, as I have said, we have seen that even though there may be, infections, but the severity gets definitely, reduced by vaccination. And so we want to still send that same message, that this is the time to really make sure that every South African gets vaccinated, and those that need to come for the second dose of Pfizer, they need to make sure that they get that second dose. Then the second thing, as you correctly say, just because we're seeing such low numbers, there has been a tendency in the country for people to actually stop adhering to the public health and social measures. And really now we want to send a very clear message that it is critical. We now know that really wearing a mask properly is one of the very effective methods and mechanisms of preventing, oneself, protecting oneself from COVID-19. And so we really want to urge the communities of this country to go back to that. So we really want to stress a message of those non-pharmaceutical interventions, that it is more important to do that now, especially seeing that we are facing a highly transmissible variant.
But,
so that's going to be important. And also,
sorry
yes.
to interject there. Is this the same message that you are also stressing with the officials that you have the opportunity of advising through this MAC committee? Because it is the very same leaders that we have seen disregard these regulations.
Yes, I know, Kathy, I know. Well, you see, this is where we always say we advise, and it becomes important for government to ensure that those regulations are adhered to. And I agree with you. I mean, we have seen how some of the rallies have gone, multitudes of people without masks. And really, right now, we will continue, because that is the only message we can send. And we therefore would leave it and make sure and actually emphasize that it is important for the powers that be to ensure that these regulations are followed through, because otherwise then what is the point of instilling those regulations if they are not adhered to? Because I mean, the next point I was going to make was the issue about large gatherings. We have gatherings now with this variant, that is going to be even more important, and it's going to be very critical as to what we do next, because right now we have got the 1st of December, World AIDS Day, coming up, and it really is going to be important, what message we send across when we say we really need to be careful about, huge gatherings. Is everybody going to adhere to that? Because we need every South African adhering to those restrictions.
Professor Koleka Mlisana, the co-chair of South Africa's COVID-19 Ministerial Advisory Committee. It certainly is not going to be the end in terms of hearing from the Ministerial Advisory Committee over the next couple of days to hear what exactly then the advice to government will be in terms of the response to the discovery of this new variant. When